Decision-making 101. Use qualified data and analytics in order to make sound purchasing decisions. On April 25th, Risk Strategies released their 2025 State of the Insurance Market Report, giving buyers insight into various industries and the overall insurance product portfolio, including recommendations and rate forecasts for the remainder of 2025. Let's dive in and have a look at how the healthcare industry is expected to perform during the course of 2025. The healthcare industry is facing several challenges, including tort reform, an increase in claim severity, and rising social and economic inflation. Mergers and acquisitions, along with cybersecurity, are being scrutinized more heavily at the federal and regulatory level. Staffing shortages and burnout amongst nurses are estimated at a shortfall of 450,000. This equates to a 10 to 20% gap required for direct patient care. Aside from turning to traveling nurses to fill that gap, organizations should consider enhancing benefits by adding subsidized child care along with tuition reimbursement for key clinical staff. Artificial intelligence in healthcare continues to improve, showing advancements in treatment planning, diagnostics, and operational efficiencies. AI cybercrime is also enhancing, inviting in regulatory bodies to more closely scrutinize the use of artificial intelligence in the healthcare industry. In the recently released 2025 Risk Strategies Insurance Market Outlook Report, the healthcare industry, under coverage considerations, should continue to take closer looks at their medical malpractice insurance policies, healthcare professional liability coverage, and cyber liability insurance. But don't overlook the need for workplace violence coverage. Sadly, healthcare workers are 5 times more likely to suffer a workplace injury following a violent event than against workers in other fields. When it comes to decision-making strategies in 2025 for the healthcare industry, the recently released Risk Strategies 2025 Insurance Market Outlook Report puts forth the following recommendations as medical malpractice and healthcare professional liability are going to continue to face headwinds. For starters, start your renewal process on insurance programs early as 120 days prior. This way you can overcome any market challenges that are faced during the renewal process and implement strategies in order to try and maintain price control. Second, clearly define coverage options, specifically for nurse practitioners, physician assistants, and contracted employees. Third, implement and follow patient safety and risk management programs. And lastly, use data and analytics in order to compare and benchmark your program against other programs within inside of your industry. Rely on your broker to provide that quality data. In the recently released State of the Insurance Market Report from Risk Strategies, the healthcare industry can continue to experience rate difficulties, including the following projections. Medical malpractice insurance with rates increasing 5 to 20%, primary healthcare professional liability rates increasing 10 to 15%, healthcare excess liability rates increasing 10 to 15%, and management liability increasing 5 to 10%. So with continued hard market pricing in the healthcare industry, make certain you're taking advantage of recommendations brought forth not only from your medical malpractice and healthcare professional liability insurance carriers, but also following best practices in terms of what works for your entity in the healthcare industry. And should we experience a hard market like we did in the early 2000s, preparing today with unique solutions could very well benefit you in the future should rates climb 250%. So if you're looking for more quality data and analytics, contact info is up there. Follow along for more tips and strategies. Newsletter out weekly.